I couldn't believe it because I've seen some people in the UK and they've got terrible scars and they've got where it's just the rub of it, it goes bad and they've got cuts and
And you were looking for a treatment. You probably researched a lot. You looked for many clinics and then you came to Jaipur. Where you got it done.
sorry, it's not even that. So in the UK, when you have, as a male, gynecomastia, like one breast bigger than the other, especially when it was the size of my right one. My right one was like an A cup, right? My left one was okay, but it was still a lot. I didn't realize till you told me. When you assessed it and you showed me, you said there's ones, two. Can't do one without the other, first of all. And I got a price in the UK for one. So that made me more confident now because I said, no, you can't do it like that. If you just do one, it's going to make the other one not symmetrical.
Yes.
And they didn't tell me that. They were willing to do one, you know? I think it was a Turkish facility that's set up in the UK, I believe. So, I'm not too sure, over the last 9 years, because sometimes when I'm weightlifting and the bar goes down on it, it inflames and it hurts. I've been to the NHS, and the NHS in the UK has free, right? I've been to them to try to get it done on the NHS. After waiting 6 months, going to 3 different appointments, and they told me they couldn't do it. So then in the end, I opted to get it done myself. But again, my son was born, and time just got in the way, and I didn't bother doing it. And I said, you know what? In a couple of years' time, I'm gonna get it all done, and we'll get everything done. What's the rush? What's the rush? But then it started getting bigger, and it's just getting more noticeable. And my son notices it, and like, when I'm going swimming or I'm going to the beach or I'm in the locker room, you can see it. I'm thinking,
So it was affecting your self-confidence a bit.
yeah, I didn't realize how much. I did not realize how much, but yes, it was.
And adding to that, because these were asymmetric breast implants, right one bigger than the left. Had they been symmetric, there won't have been this much of.
No, I'd be a top heavy guy. When you look at me and one is the dim size of the other, it's very noticeable.
Yes. And the reason we told you to go for both is just because, see, it's very easy for us to make them look symmetric if we do both sides together.
And it didn't even affect the price, which I realized what it was.
And that the aim of doing a gynecomastia surgery is to give you a flat, symmetric chest. We have 3 principles in that: flat chest, symmetric chest with no scarring or minimal scarring. So that's the aim actually of doing a gynecomastia surgery. So how was your experience pertaining to gynecomastia procedure?
The first thing I spoke about when I got here was money. And the first thing you stuck me was, listen, don't worry about that. We'll talk about your requirements. We'll talk about what we do. And we'll talk about getting you where you want to be comfortable, where you're happy with what we do, before we would discuss anything to do with money. Money is not an issue. It's not money. It's the service. It's what we do. It's our profession. And I was really impressed with that, you know? The day before, I had my hair done.
Yes.
I had 4 hours sleep because I was excited after having my hair done. I felt like a new person. I came in at 9 a.m., 9:30 a.m. on the Saturday morning. Was it Sunday morning? Saturday morning. Had the assessment, got my bloods done, got all my results back from my blood test because you guys tested for everything just to make sure, which I didn't realize that you guys went that in depth. Everything was fine. Within 4 hours, I'm in a room watching Netflix in a gown, waiting to be taken into the OR, and I went in, took 2.5 hours, but it wasn't just, you did my eyes at the same time, which I was, but for discussing this,
Gynecomastia procedure takes around 1.5 hours.
Yeah.
And then the resting time and everything is like, say, adds on to by 1.5 hours.
but either way, I left my hotel at 9 o'clock. I was back at my hotel by 6:30, having dinner.
And I'm absolutely comfortable.
Absolutely comfortable. No pain. The lines start paying once. I'm not for any uncomfortable.
And then you came to clinic next day for dressing.
For dressing.
And once we opened this, what did you feel?
Yeah, I couldn't believe it because I've seen some people in the UK and they've got terrible scars and they've got where it's just the rub of it, it goes bad and they've got cuts and there's one little hole and that's not even there. It's gone away. It's been 5 days. You know, it's just, I get shy when I think about it because Listen, having a hair transplant, yes, okay, that's cool. It's local anesthetic, but actually having yourself go to sleep and you're not even awake and trusting someone or a team of people in a country that you've not been to, change the way your chest looks was a big leap for me. And that was probably more scarier than the hair transplant, because I was also getting my eyes done, and I'd had my eye operation years ago, and twice in the UK for the injury, and once in Thailand, and all three of those surgeons could not get it right. They kept undoing. So I've left it 10 years now, and you've done it, and it's done. We've done it. And not only that, you've taken my bags on each eyes, and you've reduced my baggage, and you made me look younger. And I was worried because obviously get back eyes when this happens, and I didn't expect my eyes to go that swollen, but they did. But you revived me. Use eyes, use eyes, use eyes. I've used the eyes, and now my eyes have been set. Looks, we're on day 6.
See, talking about those investigations and everything, Leon, and also you told us that you were a bit scared while you were thinking about gynecomastia surgery. That's absolutely right, actually. But whenever we plan a surgery, see, our job is to do cosmetic surgery and hair transplant. Our priority is patient safety.
Yeah.
Nothing should happen to our patient.
Yeah.
For that, we have set protocols. We have certain set of investigations which we need. See, we need to assess your medical fitness first before taking you under light. So if you are fit medically, then only we'll proceed with the surgery. And for that, you need better investigations, ECG, chest X-ray and everything.
Yeah, which you did.
So your procedure was done safely and you're comfortable, because our pre-operative assessment is actually kind of complete.
Yeah.
We do a thorough body checkup so that nothing should happen to our patients.
Yeah.
So,
I mean, not only that, and the facility is just so tidy and organized and hygienic and clean, and it's pretty. Can't put it the way, pretty, you know. And I just can't say anything else. I can sit here and talk about it all day. I can praise you till you're up there. You're up there floating, you know, because you enjoy your profession so much, and your staff around you enjoy you, and they all want to be on your level. So you all work together as a viable team, and the unity and the unison that I see is amazing. You know, I've not had any issues. I've not had any worries about my chest, about my eyes. You know, I mean, this is like a dream. Leon West, I'm now signing off. Had all my treatments. I'm over the moon. I'm 15 years younger. I've got a skip in my step, as to say. Everything went to plan. It was successful. There's not one thing that I would change about this experience and about this trip. And I'm looking forward to going home now and seeing my kids and seeing my family.